Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us once again. We'll be speaking with Lou Ferrari, Vice President of Medical Affairs at SK Life Sciences. He's joining us here on Health Professional Radio to discuss sudden unexpected death in epilepsy, or SUDEP, what essential information patients and families need to know, and what questions to ask the physician, and also what can be done to reduce this risk. Welcome to Health Professional Radio. Lou Ferrari, thank you so much for joining.
Thank you for having me. Pleasure to be here.
Now, it's my understanding that you got more than 30 years of experience in pharmaceutical and biotech industries. Give us a brief look into what led you to your current role at SK Life Sciences.
Well, that's a great question. I joined SK Life Sciences about 7 years ago. I had an interest in epilepsy, and actually previously in my career I did work on epilepsy when I was at another major pharmaceutical company, and it's always been an interest. Very interesting disease, and also a very interesting situation for patients on how to deal with seizures, and was always willing to help with that in that situation. And I think we've been able to accomplish a lot of that recently in my stay here at SK Life Science. So epilepsy is basically a disorder. Basically, the brain doesn't function properly. The electrical impulses in the brain doesn't function properly, and leads to, if you would, seizures or muscle contractions and such, involuntary, I might add, and in some cases can be very severe. There are a number of different types of epilepsy, and some of these cases of epilepsy, as I mentioned, could be very severe and lead to many problems for patients and their families. I always want to include the families, because the families are the caregivers and the ones who, in many times, especially in younger patients, have a lot of responsibility in caring for the patient.
Now, in describing epilepsy, it seems that the person wouldn't be able to successfully drive without the possibility of an episode or ride a bike or anything else. That seems pretty obvious. But what about sudden unexpected death in epilepsy?
Yes, this is if you would, probably the most devastating thing that can happen to a family or caregiver when this occurs. And SUDEP, sudden unexpected death in epilepsy, occurs approximately 1 per 1,000 patients or 1 per 1,000 epilepsy patients. But if your seizures are not well controlled, or you've been having uncontrolled seizures for a long period of time, it may even be as high as 1 in 150. And in many cases, I have to say this, and there's been much written about this, these SUDEP cases may actually be underreported, and so it may be much higher than even the statistics show at this point. What happens in SUDEP? Why do patients suddenly expire or die? Actually, people are not completely sure what is going on. Certainly breathing, pauses, long pauses in breathing during a seizure, or too long with a reduced oxygen intake or level. And sometimes an airway can get obstructed. Sometimes when patients are having seizures, they have an overabundance of, let's say, saliva in their mouth and such. And some think it may even be a heart rhythm. There may be changes or arrhythmias with the heart, or it could be both. But what's devastating is when you see a young patient or someone comes in, and what's more typical, if you would, someone comes upon, or a parent comes in and notices that their child or husband or someone like that, all of a sudden they come in the morning and they find the patient is dead and has expired probably during a seizure in the middle of the night. And it's a pretty shocking and devastating situation for the family, obviously, and the caregiver. And it's probably the worst outcome that you can have when dealing with epilepsy.
Would you say that although we don't know what's going on with SUDEP, as you explained, are more cases due to, you said, the excess of saliva or the throat being blocked, or the muscle spasms constricting the lungs, or things of that nature? Are there certain causes of this unexpected death that are reported over others?
Yeah, well, there are a number of risk factors that have to be taken into consideration. If a patient, for instance, for long periods of time have been dealing with or has uncontrolled seizures, if they have what's called more generalized seizures, what you might know as a convulsion, where they're on the ground and they've lost complete control. If they have been living with epilepsy for many years, this could also be a risk factor. Alcohol use, lack of sleep, these are all risk factors that you should try and limit. And one of the things that I think is very important for patients and even healthcare professionals who may be listening to this is that, the most important thing you can do to prevent SUDEP is control seizures. And there are many things today. There are new drugs that are on the market, and there are new devices, et cetera. There's surgery. There are so many different things that the patient and the family or caregiver should think about in the terms of, do not accept the fact that you're having seizures. You should strive to get to what is called seizure freedom, or minimize the seizures as much as possible. Because one thing we do know, and that is that if you limit the seizures or you reduce the number of seizures, it's only common sense that your risk of SUDEP would also go down, especially if you're having what is called primary generalized seizures. This is very important to minimize this as much as possible. And do not accept the fact that, I'm having only a few seizures a month and that's okay. The family and the patient should definitely strive and speak to their healthcare professional and do everything they can to try and eliminate seizures altogether. Now, that may not always be possible. There is no cure for epilepsy. I want to make that clear. But the least amount of seizures that you have would also reduce the risk of SUDEP, and that's extremely important.
Are we seeing SUDEP more in older patients or younger patients? You mentioned having lived with epilepsy for quite a long time, being a little bit more knowledgeable and ready. What does the research say about that?
To be honest, most of the time SUDEP occurs in sort of the 20-year period between the ages of 20 and 40. We see that is the highest rate of SUDEP. And that may be due to a number of factors, both social and otherwise, as to why that might happen. But it's also extremely important for patients, again, and caregivers, especially for caregivers, to understand what is called seizure first aid. And the Epilepsy Foundation does a great job on giving you information on what to do when a patient is having a seizure. Stay with the patient. Make sure their mouth and their airway is not obstructed, that they're not going to hurt themselves. Make sure that they're not alone. Many times a patient will wake up from having a seizure. They may not know where they are. They may be confused for a little while until they recover from that seizure. So there are a number of things, and there are a number of things that the family and the patient can do. But there's also, to limit SUDEP, there's also devices that can be worn at night and such that would help wake a patient or vibrate and alert the patient, or perhaps even the caregiver, that the person is having a seizure. And that may also help prevent SUDEP and other issues that may arise. So that it's very important for patients and caregivers to be well prepared with seizures. And I'll say one other thing. There's also rescue medications that can be administered via nasal sprays that can help, limit the time of the seizure or reduce the time of the seizure and the amount of seizures. So patients should take a lot of responsibility, I would say, when dealing with their healthcare professional and dealing with epilepsy.
Talk about what kind of work SK Life Science is doing in this area of SUDEP.
We've continued to develop drugs in epilepsy, and I think it's important for patients to know is that you shouldn't lose hope. There's new drugs and new devices on the way all the time. There's a lot of research being done, both for genetic reasons and other reasons, that you should have hope that, epilepsy can be better controlled and hopefully in the future may actually be curable. But at this time, where our research is taking us right now is to try and develop drugs that reduce or eliminate seizures altogether. And that's really where SK has, in my opinion, that's where we've shown, and that's where we've actually taken the lead in trying to develop drugs that, can help reduce or eliminate seizures altogether. And have a better life for the patient. You said earlier, if you recall, patients who have seizures, many states do not allow you to drive unless you're seizure-free for a period of time. Sometimes that's 6 months. Sometimes it could be more. And socially, that's very tough on a patient, holding a job, et cetera. It all comes down to, limiting or eliminating seizures altogether.
And I do believe we can all learn more at www.epilepsy.com. Is that correct?
Yes, that's correct. And I would encourage patients and caregivers to visit the Epilepsy Foundation website, where you can get a lot of information that's very helpful and very instructional on dealing with epilepsy and dealing with patients with seizures.
Great. Lou, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio. Looking forward to another conversation with you.
Thank you very much. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Lou Ferrari. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.